As a member of ASEAN, Indonesia joined the Asian Economic Community in 2015. It means the needs of health personnel is more challenging and competitive. During this era, foreign laborers may work in Indonesia, including at health service facilities. Health Polytechnic Ministry of Health Jakarta III as one of the technical implementation units under the authority of the Board of Development and Empowerment for Human Health Resources for the management and monitorial aspects and supervised by the Ministry of Research and Technology in Higher Education for the academic aspect. In 2016, there are 38 health polytechnic institutions. Health Polytechnic Ministry of Health Jakarta III has a vision becoming an excellent higher education institution on the basis of health science and technology at the Southeast Asian level by 2028. There are 4 missions. 1. Organizing higher education on the basis of science and technology, culture, and also character to produce the qualified health manpower. 2. Developing the current science and technology through continuous research and community service in order to improve the health status of community. 3. Developing networks with stakeholders at the national and international levels in developing health science and technology to face global challenges. 4. Strengthen the accountable, professional, and transparent governance in the academic and general fields. Health Polytechnic Ministry of Health Jakarta III has values, namely faith in one God only, ethics, rational, trustworthy, dedication, accountability, and transparent character. Health Polytechnic Ministry of Health has Center of Excellence for Health Polytechnic Science and Technology in the field of elderly health technology. Health Polytechnic Ministry of Health Jakarta 3 has four majors, namely nursing, midwifery, medical laboratory technology, and physiotherapy. And there are total 10 study programs administered in the aforementioned four majors. Diploma 3 of Nursing. The vision is by 2028, it's able to produce nurses who excel in the application of nursing skills on the basis of nursing science and technology nursing. The Excellence Elderly Nursing Technology. Bachelor of Applied Nursing and Professional Nurse Education Program. The vision by 2025. Produce nurses who excel in advanced nursing care age by applying health science and technology. Excellence, elderly nursing technology. Diploma 3 of Midwifery. Vision, produce the midwifery associate graduates who excel in midwifery care on the basis of gender-responsive approach with the effective technology by the year 2025. Bachelor of Applied Midwifery and Professional Midwifery Education Program, its vision, producing professional midwives who are responsive in preparing the qualified generations through the development of continuous midwifery care models and technology, also called as COMC, by the year of 2028. Excellence, continuous midwifery care with gender responsive. Bachelor of Applied Health Promotion, its vision to produce health promoters excel in community empowerment on the basis of innovative and effective technology by the year of 2025. Excellence, development of innovative and effective information media. Diploma 3 of Medical Laboratory Technology. Its vision is becoming a program study of Diploma 3 excel in medical laboratory technology at the national level in 2025. Study program of Medical Laboratory Technology Program of Applied Bachelor. Vision to become Bachelor of the Applied Medical Laboratory Technology that excels in the field of molecular diagnostics in 2025. Diploma 4 or Bachelor of Applied Physiotherapy, its vision by the year of 2028 becoming a study program that produces the professional Bachelor of Applied Physiotherapy excels in the mastery of science and technology of neuroscience technology. Study program of Physiotherapist Professional Education Professional Program. Vision, becoming a study program that produces professional and excellent physiotherapists in the mastery of science and technology of neuroscience physiotherapy. Health Polytechnic Ministry of Health Jakarta 3 upholds three pillars, namely education and teaching, research, and community service. Health Polytechnic Ministry of Jakarta 3 is equipped with several excellent facilities such as integrated laboratory, library, language instruction laboratory, computer-based test laboratory, informal meeting garden, playroom, canteen, mini market, and tutorial corners. Partnerships and achievements. Health Polytechnic Ministry of Health Jakarta 3 has established partnerships and collaborations with several educational institutions and others, both domestic and overseas. Awards are also achieved from the students' competitions in academics, arts, and literature, both for the national and international competitions. Health Polytechnic Ministry of Health Jakarta 3, leading in quality.
The Global Gender Gap Index menempatkan Indonesia di urutan 85 dari 149 negara soal kesenjangan gender. Target Sustainable Development Goals atau SDGs memasukkan isu gender ke dalam target utama.
Ketidakadilan masih nyata dialami kaum perempuan. Sebagai bidan, kita memiliki kewajiban membantu kaum perempuan mendapatkan hak-hak reproduksinya.
Oleh sebab itu, bidan perlu memperjuangkan dan memberdayakan perempuan agar hak-hak reproduksinya terlindungi.
Sudah saatnya pelayanan kesehatan melawan budaya patriarki yang merugikan kesehatan.
Saya adalah seorang dosen dan bidan praktisi yang mendukung responsif gender, akan memberikan pelayanan yang terbaik bagi klien dan keluarga saya dan mengedukasi dengan baik supaya mereka dapat melahirkan dan mempersiapkan kelahirannya dengan aman, nyaman, dan bahagia.
Saya sebagai suami sangat mendukung lulusan bidang yang kompeten responsif terhadap gender.
Saya mendukung bidang profesional yang memberikan hak-hak ibu dengan optimal.
Begitu komprehensifnya peran bidan, baik sebagai care provider, communicator, decision maker, community leader, dan juga sebagai manajer. Maka kami mendukung program pendidikan profesi bidan.
Butuhkan lulusan bidan yang mampu memanfaatkan teknologi dan melayani dengan hati.
ICM telah menyatakan bahwa profesi bidan adalah profesi yang bermitra dengan perempuan atau yang dikenal dengan partnership with women. Oleh karena itu, tentunya konsep ini harus diimplementasikan.
Welcome all participants of Midwifery Department International Webinar 2021. The webinar is going to start in 5 minutes. To all participants, please be ready and turn on the camera. Selamat pagi, salam sejahtera semuanya. Selamat datang dan bergabung kepada para peserta dalam kegiatan webinar internasional Himpunan Mahasiswa Jurusan Kebidanan Potekkes Kemenkes Jakarta 3. Dimohon kepada para peserta untuk mengaktifkan kamera dan mematikan mic karena acara akan dimulai dalam 5 menit. Diingatkan kembali kepada para peserta untuk merename nama sesuai format yang telah ditentukan oleh panitia. Sebelum acara dimulai, saya akan menampilkan tata tertib acara. Dimohon kepada para peserta untuk memperhatikan. Excellencies, distinguished guests, participants, speakers, ladies and gentlemen, the Honorable Chief Director of Health Polytechnic of Jakarta 3, Health Ministry of Indonesia, the Honorable all speakers of Midwifery Department International Webinar, Dr. Irmansyah, SPKJK, Professor Dr. Sabarina, and Professor Hiroko Watanabe, the Honorable the Chairman of the Midwifery Department, Head of Study Programs, Chief Executive of Midwifery Department International Webinar 2021, Committee, and all respectable participants of our international webinar. Thank you for taking the time to be able to attend today's event. Kepada yang terhormat, Direktur Poltekkes Kemenkes Jakarta 3 beserta jajarannya, kepada yang terhormat, para narasumber, Dr. Irmansyah, Profesor Dr. Sabarina, dan Profesor Hiroko Watanabe. Yang terhormat Ketua Jurusan Kebidanan beserta jajarannya, yang terhormat Ketua Program Studi di Jurusan Kebidanan, dan yang terhormat undangan dan panitia dan peserta. Assalamualaikum warahmatullahi wabarakatuh. Good morning. Ohayo gozaimasu. I'm Amalia Virgi as the Master of Ceremony on today's webinar. I'd like to welcome you to Health Polytechnic of Jakarta 3, Health Ministry of Indonesia, for the opening ceremony of Midwifery Department International Webinar 2021, with the theme, Improving the Quality and the Competence of Healthcare in Indonesia. Before we begin, allow me to read the rundown of today's webinar. Sebelum acara dimulai, izinkan saya untuk membacakan susunan acara pada hari ini. Yang pertama adalah menyanyikan lagu Indonesia Raya. Yang kedua ada sambutan. Yang ketiga adalah pembukaan resmi. Adalah paparan materi pertama dengan topik Empowering Health Workers in Indonesia. Yang kelima adalah materi kedua. Health Internationally in Global Era. Yang keenam ada coffee break. Yang ketujuh adalah paparan materi terakhir dengan topik Improving the Competence of Midwives and Health Promotion in order to compete internationally. Dan yang terakhir adalah closing atau penutup. Now we are going to the first event, singing national anthem. National Anthem of Indonesia. Indonesia Raya. All the participants may sit well. Menyanyikan lagu kebangsaan Indonesia, Indonesia Raya. Para peserta dipersilakan untuk duduk siap. Terima kasih kepada para peserta. Selanjutnya adalah acara yang kedua, yaitu laporan Ketua Pelaksana. Excellencies, participants, ladies and gentlemen, we are now going to listen to the welcoming speech delivered by Chief Executive of the Midwifery Department. Ladies and gentlemen, please welcome Ms. Nabila Salma. Ms. Nabila Salma, the time is yours.
Thank you for Amalia Virgi as MC. First of all, the Honorable Director of Health Polytechnic Jakarta 3 along with all staffs, the Honorable all of international webinar speakers at Health Polytechnic Jakarta 3 Department of Midwifery, Head of Midwifery Department along with all staffs, Heads of Study Program in Midwifery Department, lecturers and staff of Midwifery Department and the entire International Webinar Committee, and also all happy participants on this international webinar. Assalamualaikum warahmatullahi wabarakatuh. Selamat pagi dan salam sejahtera untuk kita semua. Good morning and best wishes for all of us. Ohayo gozaimasu. Welcome and thank you for being virtually present in this webinar. The international webinar organized by the Midwifery Department Student Association, Health Polytechnic Jakarta 3, will be held today, 26th of August 2020, with the theme Improving the Quality and the Competence of Healthcare in Indonesia. Alhamdulillahirabbil alamin. Let us pray and praise the presence of Allah Subhanahu wa Ta'ala, because only for His permission we can be reunited in the international webinar, which is part of a series of webinars at the Midwifery Department of the Jakarta Health Polytechnic 3. This international webinar is an activity that aims to increase knowledge and develop knowledge of midwifery and health promotion to students, lecturers, midwives, health promoters, and the public about the development of existing knowledge in the field of midwifery and health promotion in order to be able to compete both nationally and internationally. Through this activity, it is hoped that all students, the academic community, practitioners, and the community can improve their quality and competence. This activity was attended by students of the Midwifery Department of the Associate Degree Study Program, the Midwifery Professional Study Program at the undergraduate and professional stage, as well as the Health Promotion Study Program, alumni, and lecturers from both of Jakarta 3 Health Polytechnic and from outside the institution. Hopefully, this activity can run smoothly, the invitees and participants can take part in this activity well. Thanks again to the organizing committee. This is the activity report from me as the chairman of the organizer of this international webinar. I apologize if there are words that are not pleasing. At the end of this speech, I close with wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh. Selamat pagi, good morning, ohayo gozaimasu.
Thank you very much, Ms. Nabila Sama, for the wonderful welcoming speech and report. Terima kasih kepada Ketua Pelaksana untuk laporannya. Selanjutnya, kita akan mendengarkan sambutan dari Ketua Jurusan Kebidanan. Next, we are going to listen to the second welcoming speech delivered by the Chairman of Midwifery Department. Ladies and gentlemen, please welcome Ms. Erika Yulita Ikhwan, SST MKEP. Ms. Erika Yulita Ikhwan, the time is yours.
Okay. Thank you, Nabila. Assalamualaikum warahmatullahi wabarakatuh. Selamat pagi, good morning, and ohayo gozaimasu. The Honorable Director of Jakarta 3 Health Polytechnic, Ibu Yupi Supartini, SKP MSc. The distinguished speaker, Professor Hiroki Watanabe from Osaka University, Japan. Dr. Irmansa, Spesialis Konsultan Jiwa from Board for Development and Empowerment, Human Resources of Health. Professor Dr. Sabarina, MSc, from Faculty of Public Health, University of Indonesia. The Honorable Vice Director 1, 2, and 3 Health Polytechnic Jakarta 3, Head of Division and Head of Subdivision, Lecturer and Staff of Midwifery Department, the entire International Webinar Committee, college, student, and all participants. It's a great pleasure to welcome you this morning to our international webinar presented by Jakarta 3 Health Polytechnic Midwifery Student Association. I'm very pleased to extend a warm welcome to all of you, and I'm honored to welcome you here today to discuss development and share responsibility for improving the quality and competence of healthcare services in Indonesia. And ladies and gentlemen, invite guests and participants. In this online webinar, we can reach participants from within and outside the country with a total 2,008 registrants from Indonesia, Malaysia, Mongolia, Timor-Leste, and Japan. I would like to take this opportunity to express my sincere thanks to all committee members and our honorable speaker from Osaka University, Board for Development and Empowerment Human Resources of Health, and from Faculty of Public Health, University of Indonesia. I truly appreciate for your support and attendance. Finally, I would like to thank all participants for your presence and support for this webinar. I wish the day will bring the understanding and desire to improve the quality of health services of Indonesia. Sekali lagi saya mengucapkan selamat datang dan terima kasih kepada seluruh narasumber yang bersedia hadir pada kegiatan webinar ini, dan selamat kepada seluruh komite dan juga selamat datang kepada seluruh partisipan. I wish you success and stay healthy. Thank you. Have a wonderful day. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you very much, Ms. Erika Yulita Ikhwan, to give us a wonderful welcoming speech for this event. Terima kasih kepada Ketua Jurusan Kebidanan untuk sambutannya. Selanjutnya, kita akan mendengarkan sambutan dan pembukaan secara resmi oleh Direktur Poltekkes Kemenkes Jakarta 3. And last, we are going to listen to the welcoming speech and opening remarks delivered by the Chief Director of Health Polytechnic of Jakarta 3, Health Ministry of Indonesia. Ladies and gentlemen, please welcome Ms. Yupi Supartini, SKP MSc. Ms. Yupi Supartini, the time is yours.
Thank you for the time. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Selamat pagi, Salam sejahtera bagi kita semua. Om Swastiastu. Good morning. Ohayo gozaimashita. The honorable speakers, Ibu Profesor Dr. Sabarina MSc, the Dean of Faculty of Health, University of Indonesia, Ms. Hiroko Watanabe from Osaka, Japan. We meet you again in this international webinar. Ibu Hiroko Watanabe from Osaka University, Japan, is one of our partner, international partner of Jakarta 3. Bapak Dr. Irmansyah, spesialis kesehatan jiwa konsultan. Beliau juga selaku Kepala Pusrengun Badan PPSDM Kesehatan, Kementerian Kesehatan. Terima kasih Bapak dan Ibu pembicara yang telah bersedia hadir pada kegiatan international webinar ini. Yang saya hormati, The Excellency of Vice Director 3 Student Affairs of Poltekkes Jakarta 3, the head of Midwifery School, Ibu Erika Yuliati, with all the management staff, and Midwifery School of Student Organization, and all the board members, and then also all the lecturer from School of Midwifery, Health Polytechnic of Jakarta 3, who could attend this international webinar, and especially all the participants, either from Indonesia and also from outside country, that already mentioned by Ibu Erika is from Malaysia, Mongolia, Timor-Leste, and also from Japan. First of all, let's thanks to the God who always give us His mighty. We are healthy and we could attend this international seminar and in this opening ceremony. Healthy is the important one in this moment, especially. All the participants and all ladies and gentlemen, it has been our gratitude to have all the distinguished speakers and also all the participants who support this international webinar, and as a director and all management staff in Health Polytechnic of Jakarta 3, firstly, we really thanks to the Midwifery Student Organization and all the committee who had this meeting, prepare all the everything, needing in this international webinar, and really appreciate to all of you who always committed, who always support every effort of Health Polytechnic of Jakarta 3 in maintaining, in implementing the quality educational process. So thank you for your activity, this valuable activity. Ladies and gentlemen, as we realize that nowadays we are still in the pandemic era of COVID-19. Almost 1 year and maybe around 18 months, we have already facing this difficult situation with COVID-19. And more than 1 year already, we implement learning process without going into the campus. We often facing the difficulty either from the student perspective or from the lecturer perspective. And I believe also in the health sector, in the hospital, our colleges facing some difficulties in providing the health care to the clients. These situations make us really in a burden situations. But then we also have the good impact, the positive impact, especially for the students and lecturers, could have lesson learned from this pandemic situation. The ability of using technology, especially high technology, in implementing the teaching learning process is increased. All the lecturers, all the students are challenging, have been challenging in using all the methodology, how the learning objective could be achieved in the difficult situation. We believe that the student, especially in midwifery school, the student from study program of midwifery and also from the health promotion are also getting a lot of lesson learned from this situation. The creativity of the students in using several variety of methodology in learning process are increased. We have already assessed how the teaching learning process in Health Polytechnic of Jakarta 3, and there are some important notes that we could say that the competency could be achieved while the student and lecturer have the nurturing effect. Nurturing effect especially focus on to the methodology that before the pandemic we do not pay attention, or maybe we do not use it, such as how the student could learn in the laboratory or even in the clinical side by using several methodology while practicing the health procedure that should be implemented. This is we see that a good lesson learned could not be with us if we do not facing this pandemic of COVID-19. So let's always be grateful to the God that we believe He give us the challenge how we could solve our problem in this difficult situation. Health Polytechnic of Jakarta 3, I kindly inform to all the participants or even to the speakers that we in Health Polytechnic of Jakarta 3 always committed to the quality. We have the motto, we have the jargon, terdepan dalam kualitas. So quality is our attention in every site, in implementations of educational process, research, and also community service. Yeah, in the 3 pillars that should be implemented in Health Polytechnic. As one of Health Polytechnic under the Ministry of Health, we always support all the programs of Ministry of Health in fighting to the COVID-19. We involve actively in every activity in the national level, and also in the provincial level among Bekasi, provincial, and also in Jakarta. So we believe that with our commitment, with our participation in fighting in this pandemic era, we could get a lot of learning process, either for the management in Health Polytechnic or for the lecturer and the students. To the participants, we hope you could get a lot of knowledge and beneficiation from this international webinar. So good luck to you all. Stay healthy and safe. And thank you very much to all the distinguished speakers who have already spent your time and share your knowledge and experience to all the participants. As what the committee asked, that we open this international webinar by saying basmalah. Bismillahirrahmanirrahim. Semoga Allah Subhanahu wa Ta'ala meridhoi dan memberkati kegiatan kita dan membawa berkah untuk kita semuanya. Demikian sambutan dari kami. Thank you for all your attention or your participation in this international seminar. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you very much, Ms. Yupi Supartini, to give us a wonderful welcoming speech and opening remarks for this event. Demikian acara resmi pembukaan telah kita lewati. Dengan begini, acara webinar internasional Himpunan Mahasiswa Jurusan Kebidanan Poltekkes Kemenkes Jakarta 3 telah resmi dibuka. Selanjutnya adalah acara pemaparan materi oleh para narasumber dan dipandu oleh moderator. Now, without further ado, I turn the time over to moderator to lead. Moderator, the time is yours.
Thank you so much, Amalia Virgi. Assalamualaikum warahmatullahi wabarakatuh. The Honorable, our international webinar speakers, Dr. Irmansyah SPKJK, Professor Dr. Sabarina, and Professor Hiroko Watanabe. Good morning, all of our participants of Midwifery Department International Webinar 2021. Thank you for taking the time to be able to attend today's event. Well, on this Midwifery Department International Webinar 2021, please allow me. I am Naura Hairuna as a moderator who will lead this international webinar with the theme Improving the Quality and the Competency of Healthcare in Indonesia. On today's event, we have three great speakers and I will explain them one by one. Our first speaker is Dr. Irmansyah, SPKJK. Excuse me, Dr. Irmansyah, have you joined the Zoom?
Yeah, good morning.
All right. How are you today, Dr. Irmansyah?
Good. I'm good.
I'm glad to hear that. I'm Naura Hairuna as a moderator on today's event. Please allow me to read Dr. Irmansyah, SPKJK's CV. Dr. Irmansyah, SPKJK is head of Planning Center and Utilization of Health Human Resource, rank or class, Intermediate Principal Advisor 4D, and IP 196201231986111001. Agency Health PPSDM Agency date place, born in Jakarta 23rd of January 1962, religion Islam, address office Jalan Hang Jebat 3, Blok F3, Kebayoran Baru, South Jakarta. Email irmansyah@gmail.com. Education, Bachelor Degree of Medical Education in University of Indonesia, Undergraduate of Mental Health Specialist in University of Indonesia Consultant, Graduate of Psychiatry Bioethics in University of Indonesia. Position, his experience while working was amazing. His last experience is head of Center Health HR Planning and Utilization since 2021 until now. Now, please allow Dr. Irmansyah, SPKJK, to deliver his presentation about empowering health workers in Indonesia. To participants who want to ask questions about the topic are welcome. You can type the question through the link in chat column, and we will answer the question in question and answer session. Please, Dr. Irmansyah, SPKJK, the time is yours. The duration for your presentation is 30 minutes, please.
Thank you, Mrs. Chairwoman, and good evening. Sorry, good morning to you all. Please, first, I would like to thank the organizing committee for inviting me to this very important webinar. And also, I'm honored here because the other speaker which I admired very much, Prof. Sabarina, and also Prof. Mr. Hiroko Watanabe from Japan, and as long as other honorable lecturer from this Polytechnic 3 Jakarta. In this opportunity, I would like to share with you the empowering of health workers here in Indonesia. Especially, I'd like to spend more time in empowering the especially with midwife. Next, please. As national guidance, we have here what we call it midterm target for planning direction of our development in health sector. We have midterm target here and focus on 5 issues here: enhancing maternal health, family planning, and health reproduction. We also want to accelerate our nutrition and recovery nutrition recovery for community, strengthening the disease control, healthy living community, strengthening health system, and controlling food and drugs. As we notice here, that the midwife could be the main resources in the first of our target here, enhancing the maternal health, family planning, and health reproduction. But also not only this first target, but also midwife could also contribute in accelerate nutrition recovery for community, especially through mother and children intervention, nutrition intervention. And also midwife could also take a role in strengthening disease control as an educator and also as the community empowerment program. And midwife also could be a role model in healthy living community, what we call it here, GERMAS. Next slide. Here is the 6 pillars on our health system transformation. I have mentioned that we have 5 targets here, 5 focus on health program, yeah. But to aim this target, we have what we call it 6 pillars. The first is primary healthcare transformation. It means that our family healthcare should focus more on community development, primary prevention, secondary prevention, and increase the capacity and capability of primary services. So here we can see that the transformation for our primary health care is mostly on prevention and promotion, and we also, the second pillars that we want to make some transformation is referral service transformation. In this referral services, we want to improving access and quality of secondary and tertiary services. The third pillar is the health resiliency system transformation. So this is, I believe, this resiliency system transformation are really important, especially in this pandemic era. So we should improve our resilience of the pharmaceutical and medical device sector, strengthening the resiliency of emergency response. So this is a kind of emergency situation here. So we should, for the next future, we should strengthening our resiliency emergency response. The fourth is health financing system transformation. And also we have focused on health human resources transformation. These 5 pillars will focus on accelerate the availability, quality, and distribution of our human resources in health sectors across the health system. So up to now, we still facing the problem on the distribution of and relocation of our health personnel, since most of our health personnel are work or on big cities. Yeah. So we have more health personnel in town and in big cities, in rural area compared to the urban area. Sorry, compared to we have more in urban area compared to rural area. We also would like to have focused on health technology transformations, as mentioned by Bu UP, that we in this era we have to adapt our way of work or way of education system, especially it is also in health sector. So technology should be our main resources. We should transform our system, health system, using this technology information like we do right now. Next. If we see the labor market, it's quite dynamic. So there are many factors can influence this labor market, especially in health sector. So here we have education center as the center for human resources for health. Like what we have here in Polytechnic Jakarta 3, there is a process of training and education, and also have improved the quality of health workers, including midwife. And we have also healthcare sector that utilize this health personnel. We could call many sectors here, including healthcare, but also not also healthcare. There is also other sector that could utilize the health worker, and this is a continuing process. Even after the health worker enter the labor market, there is still need to improve their skill and knowledge. So the Center for Human Resources and for Health give some trainings, as well as training for their student, but also give training for the professional who already on the labor market. So next slide. I have only 30 minutes here, so hopefully that will be enough time for us to have a discussion after this. So there is what we call here how to preparing health personnel according to global competence. So we have two ministry here, Ministry of Education and Ministry of Health roles. Ministry of Education give or provide academic institution that then while the Ministry of Health provide the technical assistance as well as education on professional education. These two roles then combined with technology, science, innovation, and technology preparedness should achieve or should produce a character, the health fractional with high character building, higher order of thinking, have a multiple intelligence, soft skill, and lifelong learning. So it means that the health worker is not only do technical and could deliver services as usual, but also we should provide a health worker that have other soft skill like this, character building, higher order of thinking, multiple intelligence, and so on. Then if we could success in having this health personnel, then our professional life, also professional health worker, could be competitive health in this digital and global era. So it is not also, again, it is not also academic and technical needed that we should focus, but we also should focus on how to develop and continuing development of this health personnel. Next, what we have in health service for midwives. As we know, nurse and midwives represent the largest group of health services providers globally, and also I believe nationally. The nurses and midwives are the largest population, largest health workers here in Indonesia as well as globally. And the majority of their members are women, and especially for midwife, we have specific regulation here in Indonesia that midwife should be perempuan in our regulation. It means that midwife is a woman, not there is no chance for men to be to learn or to be a midwife. So nurse and midwife have traditionally been the backbone of healthcare delivery and are now playing increasingly important roles in expanding access to healthcare, particularly for the most vulnerable population. If we're talking about vulnerable populations, it's always referred to mother and child. So, and these two vulnerable populations are the main consumer, consumer, for midwife. Midwives are essential component of the workforce and key players in the achievement of to eliminate the maternal mortality rate. Without the role of midwife, our maternal mortality rate would be hard to improve. And in this regard, policymakers must invest to overcome existing shortage to ensure that all people, particularly the poor and those that live in the remote areas, have access to skilled health midwives. So the need for midwives, not only in urban area, but also in very remote area, the community everywhere, even in very remote area, they need midwives. So we should provide this midwife and nurse and other health personnel to be available for this for the whole community. Midwife and also nurses are the utility players in healthcare. They can expand and contract their role depending on the market forces and provide training and supervision for others in outreach and delivery of health services, such as community health worker. So the role of midwife and also nurse is not only inside the building to give the health services, but also their role could expand to the community as the to provide training, to provide education, to provide information for the community. At the end, to mobilize, to empower the community through community health worker or through the community, other community members. Nurses and midwives have been key to the delivery of health services that empower women, such as family planning and reproductive service, and often serve as informal resources to women about their health and other matters. So again, the role of midwife and nurses is not only to deliver health services that need it, but also as educator and also as the agent of change for the community around them. Next. There is three, here there is three, we have 3 layers of service. And if we include the health community service, there is 4 layers of health services in our community. First is the health community services. And in every layer of these health services, there is a role of midwife. First, for the health community, as I mentioned before, the midwifery services could also take role in promotive and preventive, in early detection, and also pre-referral stabilization. For the primary health services, the midwife could take a role in private health services, as well as give normal essential midwifery services. And also in these primary health services, midwife could also take a role in promotive and prevention, early detection of neonatal maternal risk detection. We call it darurat, gawat darurat obstetric and neonatology, emergency on neonatal obstetric and gynecology neonatal, obstetric and neonatal emergency issues. And also there is a posyandu, it's other kind of community health services run by volunteer usually. And also we have in the primary health center what we call it PONET. PONET is a pelayanan obstetric neonatology emergency dasar. It's emergency obstetric neonatology emergency services. In this primary health service, the midwives should work in collaboration with other health workers. And in tertiary and secondary and tertiary health services, there is a role for midwife in these 2 top layers, as well as early detection and screening, and also stabilization of people that need the services, collaboration in handling complex maternal and neonatal complication and emergency. We do it in PONEC team. PONEC is services of obstetric and neonatal emergency, comprehensive obstetric and neonatal emergency services. We have also post-medical follow-up care in cases of complex maternal and neonatal complication. So this again, interprofessional healthcare is important factor in this kind of services. And what is the next slide, please? And what is the role of midwife and other health personnel in this global competence, especially in this modern era? There is three things that important for all health personnel, including midwife, to have or to master in this global era. Professional competencies, it's the midwife and health workers should have to master how to integrate all the knowledge, skill, and attitude in form of the work of the health profession. So there is we should have all of this skill, knowledge, and attitude during our work, during our services. And we should always learn new competencies. especially in this digital era, we should have data literacy. We should, the health personnel, midwives should have, should mastering how to read the data, how to make a conclusion of the data, and how to translate the data into for the better services for our population. The competencies in this global era, also in this modern era, also the technology literacy, not only technology information like what we currently already familiar with, but also other technology in health services, especially in midwife services. The other component that should be mastered by our health professional is interprofessional competencies. In this modern era, there is no room for working alone. So we have to see and to collaborate with other professionals to give the best of our service for the community that needs. Please, next. Here is the information on how is the distribution of our health personnel in Indonesia, and especially midwives. Here we have, in Indonesia, we have 9 health workers, 9 health workers that should be available in primary health services: doctor, dentist, nurse, midwives, pharmacists, health promoters, sanitarian, nutritionists, and laboratory staff. So these 9 health workers should be available in each primary health services. But unfortunately, there is not all of our primary health service could provide these 9 health workers. For midwife, for example, there is a lower standard in primary health. There is 737 primary health worker that is not enough, or shortage of midwives. On the other hand, unfortunately, there is also primary health primary health center which has more than midwife than needed. So in this table, especially in the left one, we can see that the distribution of our health worker is a problem here. We have some services, some places, some facilities that has surplus of health worker, but on the other hand, there is still a lot of facilities, health facilities, which is shortage of health worker personnel. And also there is, we can see in the right table, at the hospital, we have here more than 3,000 hospitals, and we can see also there is a shortage of almost 30,000 midwives for all of the hospitals here in Indonesia. So there is again the distribution problem. While there is surplus in some facilities, and unfortunately there is shortage on the other facilities. So the distribution of this health worker is always a problem here in Indonesia. Next. So what we can do for this filling the gap, filling the shortage of health worker, we have 2 kind of fulfillment, or 2 kind of mechanism for filling the gap, to fulfill the need of health worker, especially the midwife. We have a temporary worker. We send a temporary health worker to the health facilities that need, but also we have permanently program. Permanently, it means that the health personnel became what we call it service, health service, health civil service. Temporary, there is two places, hospital and primary health center. We have what we call program Nusantara Sehat and internship program for primary health care. For hospital, we have a temporary program, what we call it resident specialist and empowering medical specialists, empowerment of medical specialists. So we send them between 1 to 2 years of a period of services for the health personnel to be in this, to deliver the service in this hospital and primary healthcare that needed. So the permanent mechanism is what we call it civil servant. Next. I think this is the last slide. What is the health worker competency in this pandemic era? So previously we're talking about the modern era, but this one we're talking about the pandemic era. In this pandemic era, the clinical competencies should also focus on not only on regular services that we already learned from our educational or educational institution, but we should add our clinical expertise with knowledge about handling, prevention, and treatment effort for COVID-19 patient. How to deliver patient with positive COVID-19, for example, and how to handle babies that born during this pandemic era. So in clinical, we should also have focus on competence as caregiver, how to be a good educator, consultant for the patient, and also in the community. So competent in as well as contribution on how to prevent this COVID-19 for our community, and able to adapt and innovate with changes in science and handling COVID-19. So in clinical setting, the health worker, especially midwives, should learn and should also accommodate the new technology and in our services. In terms of competency, managerial competency, the midwife and health workers should having the managerial ability to manage workflow in the implementation of handling COVID-19. And also as an advocator for hospital management in terms of effectiveness and efficacy of the service, process, and patient healing. Competency in personnel, we also should focus on the ability to have to collaborate with other profession. This all already mentioned before, but again, I would like to stress this issue again and again, that as health worker, we should have the capacity in interpersonal ability to adapt and manage our emotion, to avoid burnout in handling COVID-19. I think that's all what we have, what we want to share here. And thank you for all your attention. And give back the floor for Chair, Mr. Chair, Mrs. Chair, please. Thank you very much. Oh. Sorry, I can share anything.
I'm sorry.
All right.
All right. Thank you very much to Dr. Irmansyah for your great presentation. Now this session will be open for a question and answer session. Reminder to all participants who want to ask a question, you can ask the question through the link that has been shared in the chat column. Reminder to all participants that want to ask the question, you can ask the question through the link that has been shared in the chat column. Selamat pagi, Bapak.
Pagi.
Sambil menunggu pertanyaan yang masuk, Bapak, apa kabar Bapak?
Baik, baik. Alhamdulillah, sehat terus. Bagaimana kampus masih sepi ya?
Iya Bapak, selama pandemi ini kami belajar di rumah. Bagaimana dengan keadaan keseharian Bapak sehari-hari selama pandemi ini, Pak?
Ya, alhamdulillah tetap jaga kesehatan, prokes ketat, dan karena dibatasi, kita juga membagi kerja di rumah dan di kantor seperti biasa. Mudah-mudahan situasi akan terus membaik.
Iya Bapak, semoga situasi Indonesia ini bisa lebih baik lagi ya Pak.
Pasti, pasti.
Alright, reminder to all participants who want to ask the question, you can ask the question through the link in the chat column. Baik Bapak, saat ini sudah ada pertanyaan yang masuk. Pertanyaan dari peserta adalah bagaimana cara tenaga kesehatan dapat mengambil keputusan yang tepat pada literasi data. Kepada Bapak Dr. Irmansyah, you can answer the question.
Terima kasih. So data literacy means that we should familiar with statistic, with epidemiological data and other data comes from survey or other research. So because the information and also the knowledge, the technology, the services is always changing and evolving. So we should always keep our professional standard as the highest as possible. So, for example, if we know that vaccination, for example, from the data we learned that vaccine could prevent COVID-19 for people in the community. So by learning this data, we could inform or educate population, our community, and support them and empower them and ask them to be vaccinated, to go for a vaccination. And also, for example, in this COVID pandemic, we learned some drug that it's not work for to treat patient with people with COVID-19. And in this regard, we should avoid or inform that that not all drugs which mentioned in the community, mentioned in or previously used for the treatment, then have to change because the new data. So the literacy of data will affect our services and also our approach for the community and for our services. I hope that's answered the question.
Thank you very much, Dr. Irmansyah, for answering the question. The second question is how to prepare health workers to meet global competencies in this pandemic era, while the currently training for skills training is limited due to pandemic.
Yeah, this is limited for face-to-face interaction, direct interaction. But in this new era, we have also opportunity to have other kind of communication, which is give us an opportunity to learn more and maybe to learn many things more effectively. So please don't hesitate to use the technology to open your computer and cell phone, not only for communication or what should we call it, social media, but also please use this technology to increase our knowledge, to link with other world, to link with other university, to have an access to journal, scientific journal, and also to follow or to attend a seminar, international seminar and others, which is previously maybe impossible for us to attend a prestigious seminar, for example. But this technology now allow us to expand our knowledge, to expand our community, to expand our network, not only nationally, but also internationally. This kind of seminar, webinar, invite other honorable speaker for foreign countries is also a kind of things that we that can increase our knowledge, increase our skill, and also increase our network. So I believe this pandemic wouldn't make us more, this pandemic give us more opportunity to develop our professional skill and professional services.
Thank you very much, Dr. Irmansyah, for answering the question. Baik, selanjutnya ada yang ingin disampaikan oleh Direktur Politeknik Kesehatan Jakarta 3, Ibu Yupi Supartini. Kepada Ibu dipersilahkan.
Bu Yupi, apa kabar?
Ya. Alhamdulillah sehat, Bapak. Alhamdulillah, terima kasih banyak Pak atas waktunya, kesempatannya untuk mensupport kegiatan mahasiswa Politeknik Jakarta 3 ini Pak.
Keren.
Iya,
Seminarnya keren.
Alhamdulillah Bapak, mudah-mudahan ini sangat banyak sekali peserta yang hadir. Selama ini Bapak mungkin kami dari Jakarta 3 aktif mensupport kegiatan Rengun juga Pak, terutama kaitannya dengan mengisi tenaga kesehatan di luar negeri ya Pak ya. Alhamdulillah ada di Osaka Hospital, rumah sakitnya apa namanya, di Osaka ya, yang aktif berkomunikasi dengan kami. Jadi share bagaimana masa pandemi di sana kepada teman-teman, kepada adik-adiknya, mahasiswa, dan kepada teman-teman dosen. Kemudian juga yang di Australia ada alumni kami juga, kemudian di Kuwait. Nah ini yang aktif mereka berkomunikasi dengan ini. Jadi terupdate mahasiswa kami bagaimana juga di luar ya Pak perkembangannya. Alhamdulillah dengan support dari kegiatan programnya Rengun Pak yang G2G ya, yang Jepang ini ada alumni kami di sana yang sudah kanggosi ya Pak, sudah profesional. Iya Pak, jadi dari lulusan D3 Bapak, lulusan D3 itu ternyata mampu menjadi kanggosi. Karena memang kompeten, anaknya sangat cerdas dan attitude-nya bagus, jadi rumah sakitnya juga sangat apresiasi. Kami bangga ya dengan anak-anak ini, ternyata dengan support yang diberikan mereka mampu Pak. Jadi ya alhamdulillah Pak, terima kasih banyak dari Rengun yang selalu mendukung kami. Nah ini sekarang kita sedang mempersiapkan untuk kerjasama dengan Yomema ya Pak yang di Belanda. Itu kami sedang menyiapkan yang untuk ke Belanda untuk juga ikut serta mengisi. Mudah-mudahan dapat sukses mendapatkan anak-anak dan anak-anak bisa berangkat ke sana untuk juga mengisi pasar di sana, pasar kerja. Ya Pak. Alhamdulillah Pak.
Ya terima kasih Bu Yupi. Memang ada paradigma lama, kekhawatiran kalau kita kerja di luar negeri seolah-olah itu mengambil aset-aset kita berharga, human resources kita, tersedot ke luar negeri. Tapi zaman sekarang ini dengan teknologi seperti ini, justru ini adalah kesempatan kita untuk saling berbagi dan saling memajukan. Jadi dengan mengirim mereka, kita memiliki resources yang bagus untuk mengembangkan profesionalisme kita di dalam negeri.
Betul. Ya. Alumninya jadi bisa memberikan kuliah pakar ke mahasiswa di kita. Ya. Sangat bagus gitu ininya. Lesson learn-nya. Ya. Terima kasih Bapak.
Ya, terima kasih Bu Yupi.
Sehat selalu Pak. Sukses. Amin. Terima kasih. Terima kasih MC.
Thank you very much Dr. Irmansyah dan Ibu Yupi Supartini. From the material presented by Dr. Irmansyah regarding empowering health workers in Indonesia, we can conclude that the direction of development in the health sector have focused on technology transformation to education system, especially in health system. The purpose of this thing is to increase soft skills of midwife and health promoters like their ability. As we know that midwifery is a fairly large health workforce in Indonesia. For midwife, we have special regulation that midwife must be women to learn to be midwife. The honorable population leads to mother and child. They are the main consumer for midwife to reduce the mortality rate both in Indonesia and worldwide. So we should provide this midwife to have access to be skilled. Health promotion and midwife have been key to delivery of health service. They empower women, such as family planning and reproductive service, so they can be an educator for public. Global competencies needs for health personnel are professional competencies, new competencies, interpersonal competencies. There are 9 primary healthcare that should be provided in Indonesia: doctor, dentist, nurse, midwife, paramedics, health promoter, sanitarian, nutrients, and laboratory staff. There are regulations for health fulfillment and development strategies. Also, for the mechanism of the recruitment is permanently, like civil servant, and temporary like hospital and primary health. Health worker competencies in pandemic era, which is clinical and managerial, and persona have their own focus to handling this pandemic. Hopefully, all of participants can take a knowledge from the material that has been explained by Dr. Irmansyah. We also thank Dr. Irmansyah for taking the time to attend to our International Webinar 2021. Reminder to all participants to fill the attendance form. The link has been dropped in the chat column and in the group chat. Our next speaker is Professor Dr. Sabarinah, MSc. Excuse me, Professor Sabarinah, have you joined the Zoom?
Yes, I do. Good morning.
Good morning, Professor Sabarinah. All right, how are you today, Professor Sabarinah?
I'm fine, thank you very much. And I do hope that all of you are fine as well. Thank you.
Thank you. I'm glad to hear that. I'm Nora Hairuna as a moderator on today's event. Please allow me to read your CV. Curriculum vitae, gender female, place and date of birth, Jakarta, 13 August 1956, nationality Indonesia, marital status married with 3 children, home address Baranang Siang Indah, Day 5, number 8, Bogor, Indonesia, tel or fax 62251320698, office address Faculty of Public Health, University of Indonesia, campus University of Indonesia, Depok, Bas Java, Indonesia, telepon 62217270-154, 62217874-975. Email address sabarinah.prasetyo@gmail.com or sabrin1@ui.ac.id. Education. She was study in public health and medical doctor in University of Indonesia since bachelor until doctor. Overseas training course. Professor Sabarinah's experience in the scientific field is extraordinary, as we can see from the fact that she has done many training activities. Work experience. As we can see from her work experience, she is an expert in public health field, and now she is a Vice Dean for Academic Affairs, Faculty of Public Health, University of Indonesia, since 2014 until now. Research. Professor Sabarinah is also a competent figure in the research field. It can be seen on the slides that the results of her research have been published every year. Now, please allow Professor Dr. Sabarinah, MSc, to deliver her presentation about responsive gender in health internationally in global era. To participants who want to ask questions about the topic are welcome. You can type the question through the link in the chat column, and we will answer the question in question and answer session. Please, Professor Dr. Sabarinah, MSc, the duration for your presentation is 30 minutes. The time is yours.
Thank you very much. Very good morning. Assalamualaikum warahmatullahi wabarakatuh. Ibu Yupi Supartini, the Director of the Poltekkes 3 Jakarta, Dr. Irmansah from the Ministry of Health. Very good morning and very nice to meet you again. And I think everybody who are joining this webinar, I do hope that you are all fine. And let me share the slides. Okay. Can you see my slides? Can you see my slide?
Yes.
Okay, thank you very much. So for this session, I would like to share about the responsive gender in health. And then this is the outline. First, we will be discussing about the understanding of what is the gender means, and also the policy related to gender and the gender inequity in health. And then this is the gender. What is the meaning of the gender? What is the difference between gender and sex? Sex actually is related to biological and physiological characteristics that distinguish men from women. So actually, we know all that the women or female has the genetics of XX, and the males have the genetic of XY. That is the sex. And then what is the gender? Gender is related to the social and relational construct. So social and relational construct, which impact the relationship between women and men individually, in families, and in larger community. So we see that sometimes we give the color of the for the girl is pink and for the boy is blue. That is the social construct. And also the relational construct. What is the relation between men and women in the household, for example? So we can see here in the illustration that men are not supposed to cook, for example, and women are supposed to cook, and then they are not allowed to work outside of the house, for example. That is the social construct and the relational construct as well. And all of us in Indonesia know this song, Sabda Alam, composed by Ismail Marzuki. So in this lyrics of this song, it reflects that there is a kind of a social construct and relational construct between men and women, between males and females. So in this case, it is the a kind of subordination, and then also how is the women and men are related, and what is the point that Ibu Kartini and Indonesia, that she started to increase the women's status by providing the educational, the increasing of the educational level. So this is the social construct of the women and men and the relationship as well. So we may start with the ICPD, looking back at more than 25 years ago. ICPD is the International Conference on Population Development. That is, this ICPD adopted by 179 member states all over the world, that actually the human rights is the point. So this is kind of in the reproductive health, for example. So it should be based on the human rights. So it is not looking at the numerical figures as only, but also the qualitatively, how is the women's status, how is the negotiation power. So both of gender, male and female, are equal. So what is the meaning of the responsive gender? So in this case, responsive gender means that we are taking the differences in characteristics and life experiences that women and men bring to the justice system and adjusting strategies and practices in ways that appropriately respond to those conditions. So in this case, again, that this is a right-based. So how the differences in characteristics and life experiences will be taken into account. And considering this, the following elements are have to be taken into account. So first is the relational, second is the strength-based, third is the trauma-informed, the holistic issues, and the culturally competent. So 5 elements are very important to be taken into account in this responsive gender. It means that we are have the response to these gender issues. And if we look at that ICPD emphasize a right-based, it means that there are 2 terms that we have to understand, equality and equity. So based on the right, we try to fulfill the equality and equity. So what is the meaning of the relational elements? It means that we work with women in relationship-based way to promote mutual respect and empathy. So we have to have mutual respect and empathy. The second is the strengths-based elements. So we have to recognize that all women have strengths that can be mobilized. Yeah, the women have strengths that can be mobilized. The third element is trauma-informed. What is the meaning? That we recognize the history and the context of personal abuse plays an important role in how women respond to the services. So in this case, this is specifically addressed to the personal abuse that we have to recognize the history and its context. Yeah. And then holistic elements. What does it mean? We provide a comprehensive case management. Yeah. So we have to have a kind of a model that it is comprehensive in the case management. And it addresses the complex and multiple needs of women in conflict with the law. So we have to again consider that this is the right base. So sometimes it is touching the law. And the last element is culturally competent. It means that we provide services that value and acknowledge the diverse cultural backgrounds of women. So in this case, Indonesia is very rich in culture, and we know that there are over that 700 languages, and also around that numbers in tribes and also the culture. So it means that we have to think, we have to consider about in providing the services, we have to acknowledge the cultural backgrounds of the women. Yeah. So what is the meaning of equality and equity? Sometimes it is kind of, we are not putting in the right term. So we know from this illustration that equality is treating everyone the same. Yeah. So we give the same box to those 3 persons. So treating everyone the same and to promote fairness. But it can only work if everyone starts from the same place and needs the same help. So if everyone, if every person has the same height in this case, for example, so it is proper to give them the same box, the same size of boxes. But equity means that we are giving everyone what they need to be successful. So in this case, the older man will not need a box, but the other two boys need the boxes to stand up towards the show, the performance of the sports. So this is the difference between equality and equity. So in this case, we have to consider that in responsive gender, in regard to take or make the decision, we have to consider the equality and equity. Of course, our goal is the equity. And what is the policy related to gender? If we look at the many ministries that related to or related to these gender issues, such as the Ministry of Health, Ministry of Education, and also Ministry of, in this Indonesia has the special ministry called the Ministry of Women and Child Empowerment and Protection. So from the 2018 policy, it shows that Indonesia focuses on these three areas. The first is women participate in politics and decision making. So behind this focus is that the women has the certain or the proper power of negotiation. The second is reducing the maternal mortality ratio. What does it mean? That behind this focus, that the women should be emphasized, in the health services, and the most of the services, the women are very focal, but the women are very central, because that Dr. Iman has already mentioned that the vulnerable people, vulnerable groups are women and child. So maternal mortality ratio is the goal outcome. It reflects how the efforts to emphasize about the women and child, and how to give the proper or how to give the adequate services to the women and child. The third area that Indonesia focus is eliminate violence against women and child. In this case, it is related to the, again, the power, the negotiation power, the bargaining power of the women with the men. And in this case, the violence against women and child is reflecting the, again, the how is the gender issues should be taken into account. So this is the policies related to gender. So now we can see, since this is in Indonesia, I would like you to bring you that in Indonesia, there is a data, this is provided by BPS, that the percentage of the women involved in the parliament, it is over than 20% as regulated, yeah. So we know that this is a kind of meeting the regulation. How is the other indicators? There are two indicators related to gender. First is the gender development, and the second is gender empowerment. What is the gender development? Gender development means comparison of the human development index in males compared to human development index in females. So we can see here that the gender development is around 91%. And the empowerment is the it reflects the percentage of the women who take the participation in the decision making, including the parliament in the parliamentary. So this is the indicators that used by the government to indicate that there is an adequate gender issues. Yeah? And I cited the result of one of the doctoral thesis in the Faculty of Public Health and Universitas Indonesia about the reproductive autonomy factor. It factors shows or reflects that a kind of bargaining position and also the negotiation. So, for example, this is only the example, the decision and desire of having child. So how is the percentage agreed by both husband and wife? How is the percentage that only husband desires to have the child? So in this case, it is good to notice that this is based on the IDHS, yeah, Indonesia Demographic and Health Survey result in 2017, yeah, and then it shows that agreed by both husband and wife are around 2/3 of the respondents. How is the decision in contraceptive use? So again, this is made by husband and wife together, only 57.6%, and the decision made by wife only is 1/3. So it shows that how can we encourage them to discuss together. How is the couple decision to use contraceptives? In this case, the question is whether wife assumes husband will not agree. There is a small percentage here, about 8%. The frequency of discussion on family planning and never or rare is quite big. The figure is 60%. So it is also a kind of figures that showing that we have to make something, we have to do something in this case to encourage the couple to have a discussion more intense on the family planning. How about the wife ask husband to use condom if STDs is occurred? So around 11%, they disagree. The respondent disagree. So they don't agree that wife ask husband to use condom. And how about the wife's refusal to do sexual intercourse? That 40% of the respondents told that the wife cannot refuse. Yeah? And wife asked husband to use condom when intercourse, also approximately 70%, that wife cannot ask husband to use condom. So these figures shows that in some issues we have to have more efforts. Yeah, and if we look at the summary also in this doctoral thesis, that the reproductive autonomy factors in the communication, negotiation, and rejection are still far from our expectations. The maximum score is 8, the mean score is 6, only 3/4, and then 2 of 6 for negotiation, and 3 of 4 for rejection. So it means that we have to encourage how the reproductive autonomy factors is improving, especially in the decision making. And this is about the violence against women. So UNFPA conducted a kind of a survey. It is stated in its website that this is the reliable data, because to explore about the violence against women inside the household is not easy. So across 24 provinces in 9,000 households, it shows that around 41% of the respondents have lifetime violence, so at least once. Yeah, so it is also a kind of consideration for us to encourage how is the violence should be tackled and should be prevented, especially. Yeah. Sorry. And how is the gender inequity in health? I would like you to also, together with me, that we will be looking at the risk factors, diagnosed factors, seeking treatment, and output and outcome. This is a kind of a flow chart, a kind of a flow from the primary prevention, secondary prevention, and tertiary prevention. And as we know that in public health, we have the pillars, two pillars, the prevention and community organization. These pillars of the prevention consist of primary prevention, secondary prevention, and tertiary prevention. What is the meaning of primary prevention? It means that we have to tackle the risk factors. So the risk factors have to be tackled, to be handled, so the disease is not occurred. The secondary prevention is the step that the prevention should, as earlier as possible, detect the disease, to diagnose the disease. And also, after that, give the prompt treatment. The tertiary prevention means that we have to reduce mortality or reduce disability by providing them the adequate facility, health services. So this kind of a prevention, these steps of the preventions is related to the gender inequity. So we can take a look at the risk factors, the disease diagnosis, the seeking treatment, the output outcome. I only give the examples in these slides that there is a gender inequity in health. So this is the first example. So in the world, globally, the population currently is around 7.8 billion people. And the sex ratio here, it is the world or the global population recorded in 2016. That the sex ratio in the group of young age shows that males number is greater than females number. So a lot of males in the world, in the young age group. But in the older group, the females are larger. Yeah, the females number are larger. So this is the percentage of the health insurance. So we know that in this case, Indonesia, for example, here, it's not the dark, but it is not the light. So in the middle, yeah. This is the coverage of health insurance. How is the Indonesia? Indonesia now is around 270 million people, yeah, in Indonesia. And the sex ratio is about 1. So you know that from 1 means that males over females number. Yeah, so males number is a little bit slightly higher than females in Indonesia. And how is the education level? This is the figures of the education level. Why I put this as a risk factors? Because education is the basic variables. So if the basic variables, for example, is if there is an equal chance to have a study or chance to have schooling years, so it means that there will be good for promoting, for understanding, for increasing the awareness. Yeah. So the education level is the basic variable. So let me show you that females is still left behind than males in education based on the mean years of schooling. So this is taken by, the data is taken from the BPS. So females is a need, we have to emphasize the education level in females. How about the health insurance coverage in Indonesia? Is there any difference between women and men? I think males are still higher than females in BPJS, yeah, and also in the work institution. Interestingly, as females is higher. Most probably, this kind of figures is related to the most of the women related to because they work in the, for example, the mass industries, for example. So the private institution, yes.
Mohon maaf, Dr. Sabarina, waktunya tersisa 5 menit.
Oh ya, baik, baik.
Terima kasih, Ibu.
Terima kasih. And this is, okay, I will speed up my presentation. So this is the smoking around the world. So in this case, again, gender is very issued here, where higher in males rather than females, of course, and also in Indonesia as well. Laki-laki or female males has smokers higher than females, yeah. And also the trend of median age of first marriage in Indonesia. This is the laki-laki or males, yeah. And this is the communicating disease or communicable disease. Yeah, communicable disease, for example, non-communicable disease, for example, is neonatal with complication. Comparing boys and girls are almost the same. And also here I give the example of TB cases. TB cases in males is a little bit higher than females. However, the bacteriologic confirm is also higher in males over the females, yeah. And this is about, again, health insurance, that health insurance and females is slightly lower than males in Indonesia. And this is, I took the examples of the drugs and modern treatment, yeah, for males and females, only a very small difference, yeah. But interestingly, the traditional drugs or traditional treatment is higher in females. This is the seeking treatment behavior that done by the respondents for the outpatient care. For the females and males, I think there is no very significant difference, but the females is they catch the outpatient care in puskesmas or pustu, while for the, interestingly, the males, they do have a trend to go to a general practitioner. This is the life expectancy in Indonesia. So females has the longer life than males, and it is not different with the global symptoms, that there are also in the trend showing that females is has the longer age. And this is also one of the example of tuberculosis, that a little bit difference between men and women. Yeah, more men catching or suffering tuberculosis. And in Indonesia, females has the complete rate, means that the complete for treatment higher than males. And the success rate also for curing the tuberculosis is higher in females. This is the last data that the COVID-19, for example, as an outcome is lowering, but interestingly, the comparison between men and women or male and females is not also significant. Yeah, this is for showing the maternal mortality ratio reduction. Yeah, we expect that it is going to decline. And this is the program target. So actually the program has already been planned by the Ministry of Health. In this case, we are very happy to see this, that there are already listed the target for women and men. And also the gender-based program has to be taken into consideration in the program, because we know that the value, the behavior, the health promotion, and the facility and infrastructure are different for women and men. Yeah? This is one of the example of the PKPR, healthcare for adolescents in Indonesia. So looking at this classic way, classic methods or classic approach to educate the adolescents, are we going to give it an proper or an adequate level? So this is the activities, education and information, clinical care, counseling, skills for health, training for counselor, peer counselor. And also it covers the antenatal care, sexual reproductive health counseling, consultation on mental health problem, HIV and AIDS, sexual transmitted diseases, anemia. All of these issues actually have to be taken into consideration is the gender. Yeah, so the gender is very, we have to design the approach is different for girls and for boys. So this is the last slides that I took the note, I put the notes that there is the difference of health condition from proximal, from distal to proximal by gender, and we identified it in the majority of health indicators, and we need to encourage researcher especially to consider gender-based analysis. So, for example, if we take a look at the profile of the health provided by Ministry of Health, some indicators, a majority indicators have already been presented based on gender, but others are still not yet. And then the decision-making should take the gender into account in the intervention, development, and monitoring and analysis of the effect. And the responsive gender, we believe that will ensure the equity in budgeting and intervention. So thank you very much. Thank you. I look forward to the question. Hello.
All right, thank you very much to Professor Sabarina for your wonderful presentation. Before that, all right. Now this session will be open for a question and answer session. Well, I will read the question. The first question is, good morning, Professor. I would like to ask your opinion about child-free. What can a midwife do to support women's choice that don't want to have children, but the culture in Indonesia seems against it? Please, Professor Sabarina, you can answer the question.
Yeah, thank you very much. Yeah, as I cited from the one of the dissertation, yeah, the doctoral dissertation, that the desire of the child based on the question, maybe I will, sorry. Okay. Actually, there is still a gap in the, and we have to encourage them, the couple, to discuss it together. So from the figures that I presented, we realized that the women power in negotiation should be increased, should be improved. So that's why if you ask about the women's choice in desiring the child, so I think this is our homework. This is that our intervention should increase the women's status, should increase the women empowering in negotiation. So in this case, how to increase this women's status? By improving the education. So education level is very important. And these risk factors, education level, is one that we have to improve, because from the data, females has only 8 years. Yeah, female has only 8 years in schooling, while for males, there are 1 year longer. So that is our homework as well. Although the participation active for schooling is increasing now, the trend is improving. That is my answer. So we have to improve the educational level first. The second, how to improve the negotiation level or negotiation power, that we improve them by informal education, by promotion, by empowering, by involving them in the community activities, in the community engagement. So in this case, we have to have a kind of organization that involves the women to be having the women to have a chance to show that they are empowered, they have a kind of an empowerment, and they have a kind of a confidence. Sometimes because of the culture, again, because of the culture, the value in the social and in the community, that the women should stay at home. They are not allowed to go outside. They are not allowed to work, for example. They are not allowed to do the advanced schooling, for example. So that is our homework. These are the areas that we have to work on. Thank you.
Thank you very much, Professor Sabarina, for answering the question. The second question is how to educate people about responsive gender with effectiveness without any discrimination gender. Please, Professor Sabarina, you can answer the question.
Yeah, thank you. Again, it is related to my answer in the previous question, that how to educate. Educate means that we have to provide the system comprehensively, that in this case, for example, through the religious leaders, through the community leaders. So if we take a look at that, what are the components that we have to collaborate? The first is community itself. The second is community means we are involving the community leaders and the religious leaders is the very important elements and very important key persons. The second is the media. The media is very powerful now, especially now at this time being that using the IT, it will be very efficient. So I think most of the women now, most of the people now are having the mobile phone. So why we don't create a kind of a media? Media is not only the IT from the mobile phone, but also the other kind of media. Television is also effective and efficient, for example, using the what do you call it, a Sinatron, for example, showing that how the negotiation. Sinatron is not about the violence, but how to increase the women negotiation and women empowerment as well. The other components is academician, of course, because they can do everlasting. Yeah, I mean, from the students and also from the lecturers and researchers, they can involve in these matters. And of course, the government and businessmen. Both are the power in the financially and programmatically support. So those are elements, academician, business, government, community, and media are known as a pentahelix approach. So those are the elements that we have to push, that we have to improve, that we have to work together in collaboration. Okay.
Thank you very much.
Yes. Is there any other question?
Yes, there is another question. Please wait for the question. The next question is from Nabila. She asked, I'm curious about how to empower men to speak up on what they have got for all forms of gender violence and have full rights on health decision making. Please, Professor Sabarina, you can answer the question.
Yes, thank you very much. In this case, the violence against women, especially in household, is a kind of 41%, are reported by the women. It is a big number, I think. So I think we have to pay this attention to this violence against women in the household, and how to make the women have the confidence, have the power to speak up. That is the problem. Again, it is based on the education, and it is based on the changing the paradigm and the social context. So in this case, we have to approach the community leaders and the religious leaders. And both leaders in the grassroots level are very important to give these values. Otherwise, if the religious leaders or the community leaders are not emphasizing these values, so in Indonesia, and this patronizing pattern, yeah. So we have to we will be having a kind of no movement for this pushing the women to have the power to speak up, have the power to report, or have the power to negotiate even. Yeah. So this is again the approach to religious leader and community leaders are very important in changing the paradigm, beside in addition to improving the educational level. And maybe one thing also, the law enforcement. The law enforcement should be fair and justice. Thank you.
Thank you so much, Dr. Sabarina, for your answer. That's all the question from the participants. From the material presented by Professor Sabarina regarding responsive gender in health internationally in global era, we can conclude that we have to know the difference between sex and gender. Sex is related with biological and psychological characteristics that distinguish men from women, and gender is related to social and relational construct which impact the relationship between women and men individually, in families, and in larger community. Responsive gender is taking differences in characteristic and life experience to the justice system, which is from right-based to the equality and equity, like relational, strength-based, trauma-informed, holistic, and culturally competent, so we can fulfill them. Sometimes equality and equity have wrong meanings, but actually equality is treating everyone same, but it can only work if everyone starts from the same place, whereas equity is giving everyone what they need to be successful. Indonesia focus are on women participate in politics and decision making, reducing MMR and eliminate violence against women and child. Gender inequity in health have some preventions, which are risk factors as primary prevention, disease diagnosis as secondary prevention, seeking treatment, output and outcome as tertiary prevention. Hopefully, all of participants can take a knowledge from the material that has been explained by Professor Sabarina. We also thank Professor Sabarina for taking the time to attend our international webinar 2021.
Thank you very much for the chance that I can share about the responsive gender. I do hope that it will be bring the benefit for all of us. Thank you very much.
Thank you very much. Well, we have finished 2 sessions. After this, there will be Professor Hiroko Watanabe as our next speaker. But before that, I will return it to the MC. Reminder to all participants to fill the attendance form. The link has been dropped in the chat column and in the group chat.
Terima kasih kepada Naura Khairuna telah memandu acara. Acara selanjutnya adalah coffee break. For the next session, the attendees are welcome to coffee break for 5 minutes. The next speaker session will start promptly after the coffee break. And reminder for all participants, don't forget to fill the attendance form. The form has been dropped in the chat column and group. Thank you.
Kami dari
Gondes.
Selamat menyaksikan.
Tell me something, God. Are you happy in this modern world? Or do you need more? Is there something else you're searching for? I'm falling. In all the good times I'll find myself longing for change. And in the bad time I feel myself.
Tell me something, boy. Aren't you tired? Try to fill that void. Or do you need more? And it hard keeping it so hardcore. I'm falling. In all the good times I find myself longing for change. And in the bad times I fear myself. I'm off the deep end, once as I dive in, I'll never meet the ground. Grasp for the surface where they can hurt us, far from the shallow now.
Ladies and gentlemen, the next session is going to start. Please be ready. Good afternoon, Excellencies, participants, ladies and gentlemen. Welcome back again to Midwifery Department International Webinar 2021 with me, Amalia Virgi, as the Master of Ceremony on today's event. For the next session, we will have the last speaker. Selamat siang kepada para peserta, selamat datang kembali di webinar internasional Himpunan Mahasiswa Jurusan Kebidanan Potekkes Kemenkes Jakarta 3. Untuk sesi pemaparan materi selanjutnya, saya serahkan kepada moderator untuk memandu. Kepada moderator, dipersilahkan.
Thank you so much, Amalia Virgi. Next, our speaker is Professor Hiroko Watanabe and Matsuzaki Masayo. Excuse me, Professor Hiroko Watanabe and Matsuzaki Masayo, have you joined the Zoom?
Good afternoon. Can you see my face and can you hear my voice?
Good afternoon,
Good
Professor.
afternoon. Hi.
Hi, I can see your face.
Okay, thank you.
Thank you so much. All right. How are you today, Professor Hiroko Watanabe and Mrs. Matsuzuki Masayo?
Hello. Nice to meet you.
Nice to meet you too. I'm glad to see you. I'm Naura Hairuna as a moderator on today's event. Please allow me to read Professor Hiroko Watanabe's CV. Hiroko Watanabe.
Yes.
17 Yamadaoka Suita, Osaka, 5650871, Japan. Telephone 81868792520. Email watanabe@shas.mat.osaka.strip.u.ac.jp. Education. Professor Hiroko Watanabe was study in Midwifery School, Department of Medical Science in University of Tokyo. Employment. As we can see in the slide, she has an excellent experience and now she is a professor in Department of Children and Women's Health, Division of Health Science, Osaka University Graduate School of Medicine since April 2013 until present. Research area. Professor Hiroko Watanabe has her expertise in evaluation and passion in improving the women's health and well-being. She has experience of working as a midwife at University Hospital in Tokyo, Japan. Her areas of research interest are nutritional education among reproductive age women and weight and nutritional management during pregnancy. Now, please allow Professor Hiroko Watanabe to deliver her presentation about improving the competence of midwife and health promotion in order to compete internationally. To participants who want to ask questions about the topic are welcome. You can type the question through the link in chat column, and we will answer the question in question and answer session. The duration for your presentation is 30 minutes. Please, Professor Hiroko Watanabe, the time is yours.
Thank you very much for introducing me. Can I share my slide?
Yes, you can.
Okay. Can you see that, my slide?
Yes.
Can you see it clearly? Okay. So let's get started. Thank you very much for inviting us today. My name is Watanabe. I'm from the Department of Children and Women's Health Division of Health Science, Osaka University. And this is my CV. So as you know, I'm a professor of maternity nursing midwifery course. And also, I'm a delegate of Japan Academy of Midwifery, Western Pacific of Region, ICM. Okay, so, and today's I'm talking about and improving the competency and the standardization midwifery and health promotion internationally. The content so I have 4 content. One is that essential competency for midwifery practice by ICM. And the second one is Japan core competency standards for the midwife practice. Third one, competency-based education. And the last one is a process of competency achievement by student midwives. So let's get started. This is a role and responsibility of a midwife. So you know the role and the responsibility of midwife. So midwife provide care and support to women and their family while pregnant, with throughout labor and during the period after the baby's birth. The details are give the necessary supervision, care, and advice to women during pregnancy, labor, and the postpartum period, and provide counseling and advice before and after screening and testing, conduct deliveries on her own and care for the newborn infant, manage complications in pregnancy and childbirth by the principle of basic emergency obstetric care, and providing primary care to women of reproductive age by the basic package of health services. So this is a question, what are the benefits of effective care and support for perinatal care? The answers are contribute to the reduction of maternal mortality and contribute to the reduction of infant mortality. Let me introduce the Japan situation. This is a newspaper's article reported by UNICEF on 2018, so 3 years ago. Okay, so this newspaper said that Japan shines as the world's safest country for having a baby in a new UNICEF report that cites universal access to quality health care as a contributing factor to low newborn mortality rate. The equivalent of 1 in 1,111 newborns in Japan died during their first 28 days in 2016. Estimated the report covering 184 countries. In Pakistan, the least safe place to give birth and make a past the first month, equivalent to of 1 in 22. So this map showing the world infant mortality rate. So the infant mortality rate per 1,000 births was 1.9 in 2019 in Japan. So Japan has one of the lowest infant mortality rate in the world. So the leading cause of infant death is congenital malformation and demonstrated abnormality. So we can see the other countries' infant mortality rate. For example, India, 28, Australia, 3, and Indonesia, 20. Okay, so Korea, 3. So Japan is the most safest place, as you know. So This is the reason for the infant mortality rate by UNICEF. So results in Asia were mixed. Japan, Singapore, and South Korea were in the 10 best places for giving birth, ranked by mortality rate. In fact, India, Pakistan, Indonesia, and Bangladesh were among the 10 countries with the greatest number of newborn deaths. India, okay, so for Japan and other countries with very low infant mortality, the report cites strong health system with ample number of highly skilled workers. This is an important keyword. So well-developed infrastructure, sanitation, public health education, and guaranteed universal access, quality care at all ages. So this map shows showing the world mortality rate. So the maternity mortality rate in 2015 was 3.8. That's Japan has one of the lowest maternity mortality rate in the world. So let's see another country. So India, 174. So China, 27. South Korea, 11. Indonesia, 126. Okay. So the reason for the low maternity mortality rate, access to family planning to prevent unwanted and mistimed pregnancy, low adolescent pregnancy rate, providing of preconception care. And in Japan, the younger women's birth rate very, very low, just 1.3%. Okay, so universal access to scale care delivery. This means existing of competency-based educated qualified midwife in Japan. So we have many qualified midwives. So timely access to emergency obstetric care for all women with complication. Japan has established functioning health system which connects all women to the service providers and the facility relevant to their needs during pregnancy, childbirth, and after delivery. So health promotion behavior. So providing of health education, including diet, weight management during pregnancy. So what are competency for midwifery practice? The term competency is used to refer to both the broad statement heading each section as well as the knowledge, skills, and behavior required of the midwife, so self-practice in any setting in order to enhance the reproductive health of women and the health of their newborn and their family. The essential competency for basic midwifery practice is complemented by International Confederation of Midwives standard and guideline related to midwifery education, regulation, and clinical practice. Indonesia and Japan are member of ICM. So, what is the competency? So, competency promote the autonomy of midwives to practice within the full scope of midwifery practice and in all settings. The role of the midwife to support physiology and promote normal birth. The role of the midwife to uphold human rights and informed consent and decision-making for women. The role of the midwife to promote evidence-based practice, including reducing unnecessary interventions. The role of the midwife to assess, diagnose, act, intervene, consult and refer as necessary, including providing emergency intervention. The competencies are integrated statement and not a list of tasks. Example are illustrative and not the exhaustive list. So this slide shows the competency or competency framework by ICM and essential competency. The update, the competency, essential competency is updated in 2019, as you know. So competency are organized into framework of 4 interrelated categories. So the outside is a general competency that apply to all aspects of a midwife practice, and a competency that's specific to care during pre-pregnancy, antenatal, labor, birth, and the postnatal period. So what skill do midwives need for providing essential competency? So this slide shows the Japan core competency standards for the midwife practice. Japanese Midwives Association established national core competency for high quality midwifery care in Japan. So we have 3 skills and ethical thinking. So can you see the ethical thinking? This is the ability to practice ethical judgment. So it is a basic ethical ability is ability to judge what is good and what is bad for providing midwifery care. This is the most important things. So student and also midwife have to have a ethical thinking all the time. So there are 3 skills: women's health care skill, and of course maternity care skill is needed. So this is a diagnose and care for period of pregnancy to perinatal care and newborns and during birth. This is the most important skills. The other skill is professional autonomous skill. This is like education, research, communication, ethics, and management. So this slide shows the scope of midwifery practice in Japan. The midwife is recognized as a responsible and accountable professional who work in partnership with women to give necessary support, care, and advice during pregnancy, labor, and the postpartum period to conduct birth, and the midwife's own responsibility and provide care for the newborn and the infant. This care includes preventive measures, the promotion of normal birth as more physiological condition, and the detection of the complication in mother and child, the accessing of medical care or other appropriate assistance, and carrying out of the pregnancy measure. So during the pregnancy, so we do the health education to reduce the risk of minor problem. During labor, so midwife assist the delivery, and during the postpartum and childbearing, so midwife support for childbearing to mother. So also, midwifery has an important task in health counseling and education, not only for the women, but also within the family and the community. This work should involve antenatal education and preparation for parenthood, and many extend women's health, sexual or reproductive health, and child care. And it means that education is one of the key words. So this is a standard midwifery service in Japan. Our goal is to improve and maintain the competence of midwives and improve the standard of midwifery service in Japan and bring high quality midwifery care to the women and their family. So there are 2 keywords: care and health education. Care is accessible, responsible, and providing in partnership with women and their family, and respecting their diverse needs, preference, and choice. So women must be fully involved in all aspects of their care, enabling them to be at the center of decision-making throughout. So health education is one of the keywords. So health education during pregnancy is important to improve maternal and children outcome. So here are two examples of using competency and how to midwifery support women with excessive weight gain during pregnancy. So what kind of knowledge and skill do midwives need for support women with excessive weight gain during pregnancy? So midwifery have to monitor the amount of weight gain during pregnancy. So what kind of knowledge midwifery need? Evidence about complications and the perinatal outcome of excess weight gain. So evidence-informed antenatal care policy and guideline. So we have to know the guideline all the time. So health condition including blood pressure and blood sugar level, because it's related to the weight gain, amount of the weight gain. So the other one is the nutrition requirement of pregnancy. So what kind of skill behavior do we need? So provide emotional support to women to encourage challenge in healthy behavior, provide information about eat healthy diet, provide information about ideal physical exercise. So another example, how do midwifery care of women during labor? So what kind of knowledge and skill do midwives need for support women during labor? So midwife promote physiological labor and birth. So midwife had the knowledge, anatomy of maternal pelvic and the fetus, mechanism of labor for different fetal presentation, physiological onset and progress of labor, evidence-informed intrapartum care policy and guideline, including avoidance of routine intervention in normal labor and birth, sign and behavior of labor progress, factors that impede labor progress. So what kind of skill and behavior we need? So provide care for women in the birth setting of her choice, following policy and protocol, provide information support and encouragement to women and support, assess regularly parameter of maternal fetal status, cervical status and vital sign, contraction, cervical change, and fetal descent. Augment uterine contraceptivity judicially using non-pharmacological or pharmacological agent to prevent non-progressive labor. So let's move on to the competency-based education. So competency based education, how the process of competency achievement must be taken by student midwives and by midwives in maintaining their competency, especially in Japan. So student midwives studying in each subject of midwifery curriculum and a maternity care skill, women's health care skill, and a professional autonomous skill demonstrated in the clinical midwifery training. So this slide shows the midwifery curriculum and the course content in Japan. So the current curriculum consists of 5 items as indicated below. I think our curriculum is quite similar to Indonesia or not. We have 28, we need a 28 credit. But next year, this clinic +3. So if the student finish this course, they have to get the credit 31. So subjects are fundamental of midwifery, midwifery diagnostic and skills, maternal and child health in the community, midwifery management, also clinical midwifery training with 11 credits. So total 28 now. So this graph, this pyramid shows us a conceptual learning model. And can you see this pyramid? So the bottom one, this is the first rank. At the bottom of the pyramid consists of trait and characteristics. These are the foundation of learning and depict the intake makeup of individual upon which further experience can be built. The second bottom one, this is the second rank consists of skill, ability, and knowledge developed through learning experience broadly defined to include formal education work and participant in community affairs. The third rank, competency, are the outcome of integrated learning experience in which skill, ability, and knowledge are focused on the performance of task. Finally, the top rank, demonstration, result from the application of the competency. Assessment is deeply embedded at all stages of this learning process. So this slide shows the process of competency achievement by student midwife. So apply the midwifery curriculum to this pyramid. So the bottom one, and this is a subject to fundamental midwifery, I guess. So that means students have to think about the ethical thinking. This is the most important knowledge. And second rank, so this is a midwifery management, a subject midwifery management, maternal and child health community, and midwifery diagnostic skill. This is a third competency. This is like maternity care skill, women's health care skill, professional autonomous skill they used. So the top one, it means the clinical midwifery training. So you can step up, you know, and fundamental of midwifery curriculum to the clinical midwifery training. So if you step up, you can get the skill and the behavior. So this is a student midwifery learn how to read the fetal monitor record during labor. So our goal is to assess the health of the fetus and oscillate the fetal heart to assess the average rate, the rhythm, and the presence or absence of fetal heart rate increase or decrease. To assess the uterine activity, frequency, length, strength, resting tone, uterine irritability, and student tenderness. And this is a student midwifery practice for ultrasound examination. A standard ultrasound exam checks the fetus physical development, screening for major congenital anomaly, and estimated gestational age. Our goals are student midwifery can provide information about the following: the fetus position, movement, breathing, and heart rate. An estimate of the fetus size and weight, the amount of amniotic fluid in the uterus, the location of the placenta. So before going to the clinical training, so student midwife to have the learn by using this ultrasound. And this is like an intake of lengthy food dwelling, because midwifery always educates the women related to the nutrition education. Our goal is to support optimal gestational weight gain, neither insufficient or excessive, reduce the risk of complication, anemia, hypertensive disorder of pregnancy, gestational diabetes, to reinforce behavior to change habits that contribute to the poor health. Also, this is a student midwife practice pain relief in labor. Our goals are student midwife learn many ways to address labor pain without medication. These techniques won't stop the pain of a contraction, but they might help you feel more relaxed and better able to cope with labor pain. So relaxation exercise, breathing technique, walking, moving, or changing position, touch or massage, applying hot pack, acupuncture and acupressure, the water immersion. This is student midwife practice for internal examination. We have some model, so they practice. So how dilatation, how much dilatation before going to the clinical training. And this is the student midwife practice for birth assistance. And student midwife practice for neonatal cardiopulmonary resuscitation. This is the most important skill. So our goals are to master standard neonatal resuscitation and personnel capable of initiating neonatal resuscitation to attend every delivery and take responsibility for care of the neonate. So clinical midwifery training, this is the most important. Also, student midwifery have to study and they use the skill and in the clinical. So student midwife learn and get practical skill as follows to integrate clinical training in midwifery diagnosis and skill, maternal and child health care in the community, and midwifery management. Birth assisted by student will be limited in principle to full-term vagina, Catholic, and single birth during a period of from the first stage of labor up to the 2 hours after the completion of the third stage. To provide a continuous care, at least one case of women from her mid-pregnancy to a month after delivery during the training period. To include clinical training to strengthen the ability to assess pregnancy progression through antenatal health checkup, support breastfeeding of puerperal women, and conduct newborn babies assessment. So this is the last slide. Knowledge, skill, and behaviors required of the midwife for safe practice. Enjoy learning essential competency in Department of Midwifery Polytechnic, Kemeni, Jakarta, Third. So your skill and behavior will help reduce the maternal mortality and infant mortality in Indonesia. Thank you for your attention.
All right, thank you very much to Professor Hiroko Watanabe for your interesting presentation.
So if you have any questions, I can answer.
You have 2 questions.
Yes.
Well, I will read the question. The first question is from Nabila from Polkesma to Professor Hiroko. What is the Japan strategies to push maternal mortality and morbidity? And how about the perception care implementation to optimizing women health before pregnancy?
Could you read it again? Which one is the first chatting?
Okay. To Professor Hiroko, you can read the question in the chat column.
So first question is what kind of skill, maternity skill? Did you say that?
What is Japan's strategies to push maternal mortality and morbidity?
You mean that what kind of skills have qualified midwifery?
Yes, how Japan to push the maternal mortality and morbidity?
Oh, because it's a hard question.
Okay, I will read the next questions. How about the perception care implementation to optimizing women health?
Ophthalmology.
Yes, how to optimizing women health by midwife?
What do you mean the ophthalmology?
Optimizing is like
Option?
how? I'm sorry, what?
Could you say it again, please?
Optimizing.
Optimizing.
Please check your column chat for read the question. Prof. Hiroko Watanabe. There is a question from Nabila Polkesma. Can you see the question from us, Professor?
And in Japan, we have a preconception care. So that means we educated the women before pregnancy. So they know that how to maintain the health by ourselves. So that's why women we have a very low mortality and infantile mortality rate. So I guess the preconception care is the most important thing. It helps to reduce maternity. So maternity mortality rate and infant rate. Also, one of the other factor is hygiene. You know, in Japan is very high hygiene, and they always clean the environment. So that's why it helps to reduce the maternal mortality rate. So also we educate how to eat a healthy life, eating a healthy diet. So they are very, very concerned about their healthy. So we don't have many obesity people. So that's why before pregnancy, they keep the healthy lifestyle. Is okay? Is this clear?
Yes, clear, Professor Hiroko Watanabe. Thank you
So
very
this
much.
is the strategies in Japan. So in Japan, the strategy is we have to do the healthy life before pregnancy. This is the most important. Before pregnancy, if the women is not healthy, they can have a good birth record. Yes.
Thank you very much, Professor Hiroko Watanabe, for answering the question. There is another question. What can we adopt from the midwife of Japan to reduce the death of newborns?
Which one is your question in that chatting?
Yes, please wait for the question to send to into your chat.
Okay, yes, it's up here now.
Okay. Please, Professor Hiroko, you can answer the question.
Oh. In Japan, and infant mortality rate is very, very low. The cause congenital abnormality. The congenital abnormality is inevitable, because it happens. So we cannot, also, some people have a gene. Can I? So, in Japan, during the pregnancy, they have a health checkup. At that time, all the time they have a ultrasound. And physician, obstetrician always checks the inside of the uterus. So we can, midwifery cannot adapt. I think OBGI, obstetrician, can adapt to reduce the death, because the abnormalities we cannot avoidable. Can you understand that?
Yes, we can. Thank you very much, Professor Hiroko Watanabe, for answering the question. Please to Mrs. Gita to help Professor Hiroko Watanabe.
Hi.
Hello, Watanabe Sensei.
Hello, how are you?
Sorry, I'm in lab now. So the question from the students ask you about, because the Japan has very low the neonatal mortality.
Yes.
So what is the strategy that already? Yes, what is the strategy that Japan
So
use?
strategy is a
especially for
preconception.
midwife?
Conception, and women have a healthy diet and keep the healthy weight.
Yeah. I
So
understand.
the most important thing, but abnormal congenitally, we cannot avoidable because it suddenly happened.
Okay, we can get it. We can get it.
Yes.
Yes, thank you so much, Watanabe Sensei. Jadi di Jepang itu mereka memiliki banyak teknik-teknik untuk bagaimana cara melakukan screening, deteksi dini yang sudah dilakukan tidak mulai dari hamil, tetapi sebelum prakonsepsi terjadi, itu maksudnya. Kenapa MR-nya sedikit rendah dan neonatal mortality-nya juga rendah begitu. Jadi pre-antenatal screening itu sudah dilakukan sejak awal. Jadi tidak tiba-tiba saat hamil, tetapi sudah dilakukan sejak awal. Itu yang dilakukan di Jepang. Oke, Sensei. Thank you very much.
Thank you.
I think it's enough. We can return to the moderator.
Thank you very much, Professor Hiroko Watanabe, for answering the question, and to Mrs. Gita Nirmalasari for help us. From the material presented by Professor Hiroko Watanabe regarding improving the competence of midwife and health promotion in order to compete internationally, we can conclude that we have two roles and responsibilities of a midwife are give the necessary supervision and care and advice, provide counseling and advice, conduct deliveries and care for the newborn, manage complication in pregnancy and childbirth, provide primary care to women. Japan has one of the lowest infant mortality rates in the world. Also, Japan has one of the lowest maternal mortality rates, or MMR, in the world. The competencies for midwife practice are knowledge, skills, and behavior required of the midwife for safe practice in any settings. The competence framework by ICM are interrelated categories. General competencies are care during pre-pregnancy, antenatal, labor, birth, and the postnatal period. Japan core competency standard for high-quality midwife practice are ethical thinking, maternity care skills, professional autonomous skills, and women's healthcare skills. There are strategies for a midwife to support women with excessive weight gain during pregnancy and labor by increasing knowledge, skills, and behavior. Hopefully, all of participants can take a knowledge from the material that has been explained by Professor Hiroko Watanabe. We also thank Professor Hiroko Watanabe for taking the time to attend our International Webinar 2021.
Thank you very much for inviting me. Thank you.
Thank you.
See you.
See you. Reminder to all participants to fill the attendance form. The link have been dropped in the chat column and in the group chat. To all of participants, finally we come to the end of this international seminar. I want to draw I'm sorry. For now, we will have a documentation. So we will have a screenshot for this time. So please open your camera. Okay, all participants be ready. 1, 2, 3. Again, slide 2. 1, 2, 3. Again, slide 3. 1, 2, 3. For your information, there is 25 slides in here. Now is slide 4. 1, 2, 3. Next, slide 5. 1, 2, 3. Slide 6. 1, 2, 3. Slide 7. 1, 2, 3. Slides 9. 1, 2, 3. Slides 10. 1, 2, 3. Again, 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 the last 1, 2, 3. Thank you very much for the participants. I would like to thank you for all of our speakers for their informative, useful, and insightful presentation, and to all of our participants for your active participations. So, I am Naura Hairuna as the moderator. Say goodbye and apologize if there were any mistakes in our seminar today. And then I will return this seminar to the MC. Wassalamualaikum warahmatullahi wabarakatuh.
We come to the end of part of our event. I would like to say thank you again for the speakers for the informative and interesting talk to audience and active participation. Hopefully, the information will be beneficial for everyone. Kepada para peserta yang terhormat, akhirnya telah sampailah kita pada penghujung acara. Saya berterima kasih kembali kepada para narasumber untuk informasi yang menarik yang telah dipaparkan kepada para audiens dan partisipan aktif. Semoga informasi yang diberikan bermanfaat untuk semuanya. Saya Amalia Virgi undur diri dan mohon maaf apabila terdapat kesalahan. Terima kasih. Wassalamualaikum warahmatullahi wabarakatuh. Don't forget, there are several announcements from the committee. And next, untuk menutup acara pada hari ini akan ada penampilan dari Jati Band.
No, you know I don't mind.
Demikian rangkaian acara webinar internasional Himpunan Mahasiswa Jurusan Kebidanan Potekkes Kemenkes Jakarta 3. Terima kasih atas partisipasinya. Diingatkan kembali untuk peserta tidak keluar dari grup chat dan mengisi link presensi akhir. Thank you very much for your participation. Reminder, please, for all participants, do not leave the group chat and fill the attendance form. Thank you.
Empty hearts and neon lights, they're playing with my mind. Gotta get out of here tonight. Oh, I wanna run off and fly. And I'll tell myself it's fine to be alone, just to find